Hello, my name's Angie Ellis. I'm a urology clinical nurse specialist.
Hello Angie, thank you so
Julie.
much for coming today and agreeing to talk about your career pathway development. Would you mind just giving us an overview in terms of, how you came into nursing in your career pathway?
Okay, well, sadly I lost my father earlier this year, but if he'd have been here now, he would have told you that was my ambition from being 5 years old. And he was very much a pioneer of my nursing career. I practiced shaving on him, washing, all sorts of things, even CPR when I first learned it because I was so excited. Unfortunately, going back many years, I went to a secondary modern school. Wasn't particularly ambitious, just knew I wanted to be a nurse. Went to the hospital services careers advice place in Nottingham that was available at that time. I didn't have any qualifications and I wasn't particularly academic, and found out that there was enrolled nurse training. Thought that's fine for me. So that was the career pathway I was going to take. But at that time I was 16 and I couldn't start my training until I was 18, so I had 2 years to fill. So I decided to go to college, which, as I say, not being very academic, was probably not my best choice. And then suddenly discovered I could be a cadet nurse. But I went as a cadet nurse in psychiatric nursing, which I really enjoyed, and I think it was good in some respects, but it really wasn't the kind of nursing I wanted to do, and I found that out quite soon. Applied at Mansfield for enrolled nurse training because that was when the earliest training school from me being 18 that I could get into. So I did my enrolled nurse training through Mansfield and District General. Worked there for a short period of time in theatres and on male surgery after I qualified, and then went to Nottingham to do a paediatric course, which they did a special paediatric course for enrolled nurses at the Nottingham Children's Hospital. During that time I'd married and then suddenly discovered I was going to do my own paediatric course. So I left nursing when I had my children. I didn't work at all for a couple of years, which was nice in some respects, but then decided I needed to go back, and I went back on the bank at Nottingham City Hospital. And I worked on the bank for nearly 13 years with the support of my parents who helped look after my children. I did bank and then I got substantial posts. But all of that time I worked in urology, and that became my love, and it's always been my favourite directorate. I worked on the ward, I worked in urology theatres. Unfortunately, during that period of time I lost my mum, and my mum and dad were childhood sweethearts. My parents' dream was to retire and go and live at the seaside. My dad retired and wanted to go and live in Cornwall, and I said, sorry Dad, there's no chance. And so he came to live in Sutton-on-Sea because my aunt and uncle lived there. Suddenly found I was spending a lot of time sort of toing and froing, and so looked around at options, and I got a job on Somersby Ward at Louth County, which I was told was predominantly urology, but unfortunately wasn't the kind of urology I was used to. By which time as well I'd had a period where I was offered the conversion course within the hospital I was working in, but because I wasn't particularly academic, I was quite frightened that I would do the course and fail, and if I did it within the hospital directorate, I would everybody would know that I'd failed. So prior to going to work on Somersby Ward, I went and worked in a nursing home, and I funded my conversion course myself because that way it was fine. And so I did the conversion course. Then I did go to work at Louth County. I reapplied and got a job, and got a job there. But by this time I regretted very much my non-academic status, so I decided I was going to do my degree. Again, I couldn't get funding and I couldn't get time off, and so I did the first year self-funded, and in my own time predominantly. And then I met a very nice urology matron who was very kind and helped me to get funding and also to get some study time, and that I found really beneficial. She also then helped me to further my career by giving me advice, and I went to work at Boston on the urology ward there. Stayed there for a short period of time. I did apply for the junior sister's job, but unfortunately wasn't successful in that post. But then the urology specialist nurse job came up again, going back to Laos. So I went back to Laos in that post, and I've been in that post now for nearly 20 years.
Wow.
Yeah. Something that I really love, I've really enjoyed. A lot of the study that I've done recently has been around, I'm a nurse cystoscopist, which I had the opportunity. I went to Frimley Park for a day and did work around there, and then was very much supported by the consultants and the urology team, so I achieved that. It did take me a long time because sometimes I need a bit of a kick. I'm not particularly confident in saying yes, I can do this, and I won't say it until I feel I'm really ready. So I achieved that. I went on and got funding for my masters. Unfortunately, I didn't finish my masters, but because I did distance learning study, very well supported. Ulster University, absolutely brilliant. But I think at that time I had a lot of issues in my personal life, which were quite difficult for me to juggle my studies and my full-time work. So I didn't do it. Something I really regret, but now coming up to the end of my career, I think I don't need it now. And I proved to myself that I could study at master's level. I did achieve 3 modules, so I didn't have much left to go. I've done a foundation in oncology. I love working with the cancer patients, and now I'm one of the senior cancer specialist nurses.
So in terms of your role, Angie, you talk about obviously being the urology nurse, and you talked about some of the skill sets that you have around this nurse cystoscopy role and things like that. Are there other sort of roles that that you embrace in terms of your specialism?
I very much took a lead in the bladder cancer patients. When I first came into the job, I thought prostate cancer would be my favoured disease, but I very soon found that because of doing the nurse cystoscopy, I wanted then to expand that. I do the bladder cancer treatments, and we also, ULHT, very proud, we have the most successful bladder cancer support group in the country, which Mr. Varadraj and myself have been running now for the last 6 years. And that's we do it on a Saturday morning, because what we did was we took a team of patients and said, right, all of the guidelines say you need a support group, but the support group is for you, not for us. We know as health professionals, but what do you want? What do you want to achieve from it? They gave us guidance, so we do an informal Saturday morning in a village hall. We have speakers who are nothing to do with healthcare or anything else. So, and I say now we have one of the most successful groups in the country. We were very lucky that the founder of Fight Bladder Cancer came to one of our groups, and he was really impressed with what we do. So that's been really my lead. I've sort of led on the bladder cancer for quite a while. I've assisted in peer review, which gives us our standards and what we need to achieve. For the last 5 years, we've run 50% lower nursing staff than we should have had for numbers of patients, but we've just really been fortunate now. We've got 2 new Band 6 CNSs come to join us just in the last few months. So we're really quite excited now that, because one of the big things now for all cancer patients is the role of the key worker. And the key worker is primarily the person who is the contact for every cancer patient. And it's something that we've tried to achieve but not achieved particularly well. But now with 2 new members in the team, something that we really think we're going to be able to roll out and really support and embrace that.
There's 2 things I'd like to pick up with you, if I may, Angie. First thing is obviously you came from a teaching hospital in terms of Nottingham, etc. How has it been for you working within Lincolnshire? Would you recommend it to others?
Yes, I would. The reason for that being it's a smaller directorate and that it's a smaller team, but I think it's a supported team, and there is very much, particularly within urology, there's a lot of scope for nurse-led services, and we do get the support from the consultants, and we are encouraged to go down the field of I have my own caseload of patients. From the nurse cystoscopy role, we have a nurse consultant now who does trust biopsies and that. So we are very much encouraged to move the service forward, and I think that's something that's more achievable in a smaller trust than in one of the bigger trusts.
Perfect. And then my second question to you is that you noted earlier that you're perhaps coming more to the end of your career. Number one, what will make you stay a bit longer?
Yeah.
And secondly, in terms of staff coming that are embarking on their career, what advice would you have for them?
Right. Firstly, I'm going to retire in 18 months' time. It's going to be one of the hardest things I ever do because I absolutely love my job 90% of the time. The 10% I don't is the 10%. We all don't like our jobs because of other things and pressures and things that happen. What would encourage me to stay? Possibly because my husband is younger than me and he won't be retired. If I was offered some part-time work, probably not at a band 7 level, but and to be able to support my other colleagues and still be there to help them, support them, train them up and that, then yes, I probably would stay in a part-time role with less responsibility.
Mm-hmm.
And that. And from my colleagues coming in, I would say use your peers, take the education that's offered. There's lots of education out there. You maybe have to look for it. Don't expect it to be sort of led through for you. Look at your own development plan. Look at what you want to achieve. Use your appraisals to put those things into place and ask. Whatever you want, ask. It may not be readily available. Funds may not be readily available, but there are things that we can do. There are access to funds for education. We can support each other, and I think if you work closely as a part of a team, you'll achieve a lot more.
Thank you so much, and thank you so much for talking to us today.
You're welcome. Thank you.
Thank you.